So what is the evidence of the technology? We have clinical trials. We did an international multi-center trial. We participated, the Australian participated, and also the US participated. And we put the data together and we analyzed the data, and what we are able to show, when you offer the technology, most of the patients really show the benefit after half a year. It depends which is your endpoint, if you go for lung function or if you go for quality of life. There are different signals. Personally, I believe for my patients, quality of life is the key issue, because none of my patients knows how good is his lung function, but all of my patients knowing if he is enjoying life or not. And when you look for the quality of life, you see nearly 80% of the patients in that multicenter trial showed effect. How persistent is the effect? You see, when you go for the 12 months data, you see there is some change in the lung function. The peak is after 6 months, but we have to accept that we cannot modify the disease. So the CBD disease is ongoing. Therefore, we have to accept that there will be a decline in all the lung function tests we do. But when you look again to the quality of life measured in that trial by the St. George questionnaire, there is a persistent improvement in the St. George. That means the number is going down. So the patient feels that improvement in quality of life after 6 months, and he has the same feeling after 12 months. So from the patient perspective, very convincing data even after 12 months. And the side effects? You see on that slide clearly, the side effect number 1 is the inflammatory response. And this occurs within the first 30 days. This is what we want. And this is what we are doing. So you have to accept that the patient has to go through that exacerbation valley. But over the time, when the patient went through the first 30 days, nothing special happens. You see in that graph, everything is comparable what happens to the daily life of the patients without that treatment before. So everything happens within the first 30 days. And again, here you see what I mentioned before. When we are grading exacerbation, when you look for biomarkers, you see what we normally see when we have a patient suffering on exacerbation. And also what we learned, that when the patient really feels that exacerbation, he have a higher prediction that he will become a success of the technology. Because when you look to that patient having had a respiratory event after the procedure showed a higher improvement than compared to patient not feeling anything after the procedure. So when you talk to your patient after the procedure and he feels not as good, you can say, don't worry, you will have response after the time, because you realize that we do something in that clinical trial. And the question, can we also go for patients not only suffering on end stage, so it's also maybe a technology for the CBD group. In the trials, there was a chance that you also can bring CBD stage 3 patient in, and you see even this CBD stage 3 patients benefiting from the technology. But to be honest, stage 4 is the major group, because the improvement for stage 4 patient is higher than for the stage 3. But when you have a patient with a lot of symptoms in stage 3, this is also technology, because when the patient is symptomatic, receiving all kind of medical treatments, you can help him, because you can improve his symptoms and you can improve his quality of life. With the help of the company, that really we sliced up all the data, because I showed you, looking to the St. George, 80% prediction of 80% have really an effect, not 100%. So can we have, looking into the data, an idea which is a predictor of success? And what we learned, when you look to the heterogeneity of the disease, a lot of destruction there, more healthy tissue there. There is a clear signal when we go for patient having a higher heterogeneity index. So even having a difference between the lobe, it looks like that going for that subset of patient, the number of responder is dramatically increased when compared to the overall set of the data. Here you see how the heterogeneity index was split up within the group, and there you see the data. Reduction in volume, high heterogeneity, more reduction. lung function, FEV1, high heterogeneity index, better improvement in the lung function. RV, higher heterogeneity index, and more reduction on the RV. So clearly signal, when you go for patients which having a higher heterogeneity index, then you have a patient group which have a higher success rate. The same here shown for the St. George questionnaire.